Hi, I'm Joey, and today I'm going to talk about the laboratory and instrumental diagnosis plan for the parasitic infection, particularly echinococcosis. So before seeing the actual results, I will be discussing some expected changes that you might be seeing in the laboratory examination. It's like what you are going to expect for the result. So for the lab diagnosis, for the total blood count, there might be some increase in the hematocrit due to dehydration of the patient, and there will be leukocytosis, particularly there will be eosinophilic leukocytosis as it is a parasitic infection. So the hemostatic system might be affected, and the ESR rate will be increased. CRP also might be increased, and the electrolytes will be affected as patient is dehydrated, and also the liver function test or the enzymes will be increased, and the bilirubin levels will be high as patient is having jaundice. Now we can see the actual result of the laboratory test. So as expected, the hematocrit is increased, eosinophilic leukocytosis is present, and ESR and CRP is also increased, the prothrombin time and the INR is also increased. Sodium and chloride are low, and the total bilirubin is high, conjugated bilirubin is high, and ALT, AST, and ALP are all high. The increasing in total bilirubin and conjugated bilirubin may have been an indicator that the patient is having mechanical jaundice. Now moving on to the result of the instrumental test. So firstly, we have the pain chest x-ray. So on the chest area, there shows that there's no pathological changes in the thoracic cavity and the mediastinum. However, we can see there's calcification of the cyst on the liver, on the right side of the chest in the picture. And next we have the ultrasound of the liver, and it seems that there is presence of masses on the right lobe of liver without vessels surrounding it. So it is a cyst, and there's also signs of hepatomegaly. And moving on to the CT of the abdomen, there is presence of cyst in the right lobe of liver. So there's appearance of a central avascular area with a hypervascular rim, indicate that there's presence of cyst, and there's also signs of hepatomegaly. And next we have endoscopic retrograde cholangiopancreatography, ERCP, indicates that there is bowel obstruction, followed by the ultrasound of kidney, indicates that there's no abnormalities, there's no changes. For urinalysis, the urine is in dark color, and there's increased content in the conjugated bilirubin and decreased urobilinogen. For stool test, the stool is clay colored, and in microbiological test, there's presence of echinococcus eggs. And the serology ELISA test for echinococcus antibody IgG, there is positive result for echinococcus granulosus. For fine needle aspiration biopsy of the liver cyst, there is presence of echinococcus eggs in the microbiological test. And for ECG, everything is normal. For Cassini skin test, it's positive. For endocrine test, there are no abnormalities or changes in the hormones. And for the preparation of surgery, ABO and RH typing is done, where the patient has blood type of O negative, and for HIV and hepatitis, both results are negative.